What are the different types of x-rays? Well, there's quite a few. So I'm going to try to just explain to you which ones they are and why we use them. So let's say you come in for a new extensive comprehensive type of exam as a new patient where you want just a cleaning, right? Well, then that's where we actually do something called bite wings. And bite wings are really of the back teeth on each side where we can see how the two teeth come together, or all the teeth come together, and we can actually look for any kind of cavities that may be happening between the teeth there. And also we can look at the bone that holds the teeth. So the bone should be at a certain level. Bone that actually goes away, it tells us that there's something going wrong with the gums, and there's some gum health issues. So those are bite wings. There's something called periapicals, or PAs. Those are used to see if there's any issues above the teeth on the top or below the teeth on the bottom around the root for any kind of infections, anything that's just not normal. Make sure everything's kind of healthy in that sense. Those are called PAs. And so typically if you have an issue or an emergency and you want to come in and got a toothache on this tooth, that's what we'll do, more like a PA. Another x-ray that we typically use is something called a pano. And a pan is a panoramic, is a long way of saying it. A pan is an x-ray of the entire jaw and head kind of in this region. And you can see not only the loud noises that can happen, but you can see the entire jaw relationship. You can see maybe any kind of gross issues. When I say gross, I mean not gross and dental, I mean bigger issues. And then it's not really specific for particular teeth. However, you can kind of get a good grasp of kind of what's happening overall with the health, or if there's a big problem with the tooth in the back, you can see a hole there or any kind of infection. So it gives a good general idea of kind of what's happening, not a detailed view like a bite wing or a PA. Another x-ray that we tend to use more and more common now are called cone beams, or like a CT scan in the dental office. And these are 3D images where we can actually really see in detail small little infections happening around the tooth. We can see the real detailed anatomy of the actual bone that holds the teeth, the anatomy of the tooth itself. And you can also sometimes see cavities in there as well. It's just not as good to diagnose the cavities unless they're really, really large. However, you can actually see a lot more and get a better overall picture than a pan. So those are the 4 different ones we typically use. And it's really up to the dentist to understand the nature of the problem that they hear from the patient to determine what type of x-ray should be taken. Hope that helps.